Welcome to our YouTube channel, guys. My name is Sarah Ibarra. I'm joined by my partner, Amayah Robinson, and today we are going to talk to you guys about beriberi. So, what is beriberi? Well, stay tuned. Oh, and enjoy the memes along the way. Beriberi is a vitamin B1, aka thiamine deficiency. Thiamine is needed to break down and digest foods to regulate your metabolism. There are two types of beriberi, wet and dry. First off, let's talk about wet beriberi. Wet beriberi affects the cardiovascular system. It can be life-threatening and requires immediate medical attention since it can affect the heart. So if you ever get wet beriberi, start running to the hospital because you need urgent care. As you can see in the picture, this patient has limited circulation in their legs, which is why their legs are appearing to be swollen. Next up, you guessed it, we got dry beriberi. This one affects the central nervous system and muscle movement. It is known to be easier to treat than wet beriberi. Now, for the origin of the name. So, the word beriberi is derived from the Sinhalese word meaning extreme weakness. In dry beriberi, there is a gradual degeneration of the long nerves, first of the legs and then of the arms, with associated atrophy of muscle and loss of reflexes. Now, I'm no doctor, but I bet if one gets this feeling, they're bound to feel very weak. So, what should you do if you get beriberi? You have some options. Of course, the best thing would be to consume a thiamine-rich diet. However, there are also alternatives for thiamine infusions. They come in pills or shots, and the normal retail price for those pills per 100 tablets are $10.12. You could also get a thiamine infusion in the form of a supplement or an IV. Now, in the case of these infusions, there are rare cases where skin reactions may occur. So just a side note, you'd want to watch out for any rashes or things like that when consuming these kinds of supplements. Who is most at risk for developing beriberi? Well, first up, we got alcoholics because excess alcohol will limit thiamine absorption. And then also breastfed babies with thiamine deficient mothers, those consuming a high carb diet, those with hyperthyroidism, people with high levels of stress, and lastly, people who participate in excessive physical activity and exercise.
Signs and symptoms of beriberi are fever, nausea or vomiting, chest pain, rapid heartbeat, fatigue, tingling or loss of sensation in the fingers or feet, mental confusion, and weakness. To prevent a disease like beriberi, consume enough thiamine. You can go to a vitamin store and get vitamin D pills and 1.2 milligrams daily for men and 1.1 milligrams for women. To check if you are diagnosed with beriberi, there are blood and urine tests to determine thiamine levels, a physical exam to check for your heart, breathing, or swelling problems. Populations most affected by beriberi is most common regions in the world where the diet includes enriched processed white rice, which only has a tenth of the amount of thiamine as brown rice. In 1897, Christian Educam was sent to the Dutch Indies to study the cause of beriberi, a severe disease affecting residents of Java. Educam found that a beriberi-like disease that could be produced in chickens by feeding them a diet of polished rice, aka white rice. Diet restrictions for beriberi are stay away from alcohol, avoid diuretics, eat a nutrient-dense balanced diet such as meat, fish, and seeds. And that is our presentation on beriberi. Thanks for watching.